over. So week 10, what we're going to do today is we're going to do that Kahoots, that 36 question Kahoots. And we're also going to be going over some math questions. So anybody who has any issues with any math questions, we're going to do it. I'm also, because I know when you're med-surg and going into capstone, you're going to have to do things like mics per kilo per minute. And a lot of you go, it's too hard of a question. So I'm going to show you how it can be so easy. It's going to be so easy. You're going to go, well, why don't they teach it to me that way? Well, I did teach pharmacology for RNs for 5 years on ground. So I have learned my own method. And it's not that ratio, proportion, analysis, adding, subtracting, Xing off things. No, that's too much place for errors as far as I'm concerned. So I do it easy. We're going to do that. We are having a class next week, okay? Not next week, week 12. And all it is a summary. You just come in, pop in, tell me your grades look okay, you're happy with them. I can talk to you about where maybe your weaknesses, maybe your strengths, what you can do for next semester, all of those things. But they, at least if you pop in, I could give you credit for attendance. Because if not, week 11 is your HESI, that is your attendance, so no class. But week 12 is a class, but it's not a long class. It's just pop in, let's talk, look at your grade books, tell me that you're okay with it, and we'll go from there, okay? Who came in on iPhone so we can change your name to a person?
Sade.
Who
Can
is
you
it?
hear me? Sade.
Oh, Sade, sure, not a problem.
I look different.
You do.
I
Your
comb
hair
my
is
hair.
all over the place. Remember the last time you're like,
comb
my hair. Yeah.
I'm on campus, and Novak wants to see my hair pulled back and kept neat.
Oh, yes. There we go. Now, before I start going over these things that I just discussed, the Kahoots and the math, has anybody in any other area that you feel that you want me to go over, that you feel weak in? All right, as we go over things, if you see something, think about it, write it down, and at the end of the Kahoots, we'll do it. You could pop me in on any topic and I could talk, okay? I don't have to study it first. I've been teaching so long and I've been a nurse for, let me see, 47 years, I think. So forever and ever and ever. And it's always been my dream to be a nurse. So I still could be a nurse and I can live vicariously through you all now. So I love that.
Can you revisit APGAR intervention whenever as part of your
Which one? I can't hear you.
APGAR intervention.
APGAR scores and what we do with APGARs and what we should do.
Yeah, for newborn.
I can talk about it and I could tell you what I know about it. It's more OB, but I understand APGAR scores and what we need to do and what it's looked for, okay?
I'm seeing a lot of questions, so that's why.
Have you what on your Saunders? Okay.
And
I can talk to you about it. I can absolutely talk to you about it.
Just as a part of what you're already
All right, not a problem. Listen, I'll figure something out. So here we go. It's only 36 questions. And again, I will be talking as the questions come up because I want you to understand them, not just a question and an answer. I don't want you to memorize things. And I know in your other classes, sometimes it's all memorization, but you're almost capstone. And in capstone, you have to think a little more. And that's why I do these Kahoots. And I did do most of the Kahoots over again this semester for you all to get that information you do need.
Hey. You doing a little bit. That's it. All right. How you been? It's your last quarter.
So who else is going to join me on the cahoots? Dorinda, Alex is there, Jarday's there, Seneca's there. Giona, where'd you go? You going to join?
I'm trying to sign in now.
Okay, thank you so much. Chandra, are you going to try to get in here too?
Yeah.
Thank you. I think it's important that you do try to actively play the game. And this in no way reflects upon your scores, your grades. What this is you're trying to think and answer a question and then look what the answer is. And most of the time, I'm going to tell you why it was that answer. And I think that will help it stick a little bit better. All right, let's get going, get it done. So here we are, review number 2. You had the first one last week. A child is manifesting signs of shock after a motor vehicle accident. What finding should be reported? What is shock? Shock could be, any type of shock. But with shock, you usually see decreased blood pressures. You're going to see elevated rate. You're going to see that capillary refill start to get less. That, mentation, you're going to start to get confused. But the first thing you start to see is a narrowing pulse pressure. And that's when the diastolic and systolic start to meet each other, okay? That is a narrowing pulse pressure, okay? Very important concept if you ever want to work in the emergency room. A child is going to surgery for an appendectomy, and the doctor gives a dose of atropine. What is this used for? Now, many times when they do abdominal surgery, they're going to be given atropine. Now, atropine is not sedation. Midazolam, your Versed, those things are sedation. But when we're doing any sort of abdominal surgery, remember your stomach still secretes stomach acid, and you still have some little bit of peristalsis. But once you open that belly, those intestines stop working. So all those oral secretions become in the stomach. And what it does is it keeps producing. And if you don't decrease oral secretions, this person's going to vomit. Can you imagine vomiting after an appendectomy, what that would feel like? So that's why they do it. A child with cystic fibrosis is receiving ticarcillin for pneumonia. What assessment should be reported immediately? Well, what is ticarcillin? It's an antibiotic specific to lungs. So whenever you give a child an antibiotic for whatever reason, what are you always concerned about? When you start seeing petechiae, this is probably going into an anaphylactic. There's some sort of allergic reaction is going to occur. It may just be a rash, but it could go and, of course, include the airway. That will be reported immediately. We can treat it immediately. And it's usually just with a little bit of IV Benadryl, right? Diphenhydramine. But they could go on to wanting even more. And that would be giving some steroids, some Solumedrol, and the Benadryl. And then other stuff to prevent that histamine from that anaphylaxis. When a child is in ICU, the family is at risk for which of the following without clear and empathetic communication? So this is one of your questions, isn't it? Did you do a discussion question all about this? So which one? Well, it's going to be more like a PTSD. It's like they're in shock. They don't know what's going on. Their child is sick. And then they'll go through the periods of grieving the illness. And that could be just an illness they'll grieve. They can be angry. They get sicker. All right. And sometimes it's like, no, they're going to get better. They're going to get better. And not all the time do they get better. But it's called PTSD, believe it or not, post-traumatic stress syndrome. You're assessing a 10-year-old boy and you suspect an innocent murmur is present. Which is seen with this type? Like, how do you know if it's innocent or not? We've heard that description all the time. Oh, it's just an innocent murmur. So this is the one where if they're sitting down, laying down, you can hear it more loud. As they stand up, it becomes very soft and not even present. So that is called an innocent murmur, which means it's not affecting blood flow or oxygenation or blood pressure. Everything is okay with it. And it doesn't need to be repaired. It just needs to be watched. The PN understands that benzodiazepines are useful in the treatment of all following disorders except. This is like your Ativan, your lorazepam. This is your midazolam. And obsessive compulsive disorder is something they don't use it in. They use different sort of psychiatric drugs for that. But if you're anxious, they're going to give you, a little Ativan or Xanax to take, right? Alcohol withdrawal, it's like a seizure. So they give lorazepam, which is the Ativan. And seizures, even when they become, status epilepticus seizures, they give Ativan to try to stop those things, the lorazepam. So benzodiazepines are there to calm you down. The obsessive compulsive is different sort of drugs. We have to make your mind calm down and think better. A mother of a 3-year-old is in the clinic and she asked about teeth eruption. Like, when are these teeth going to come out? Baby teeth come out and her permanent teeth come in. When? I know right now my grandson is just about to start losing his teeth. And actually, I was telling him last night, and he's like, no, I don't want my teeth to go. He thinks it's going to hurt or it's going to hurt getting, pushed in there. But the shedding of deciduous teeth starts about 6 years old, which is like kindergarten, first grade, okay? And then the permanent teeth will come in. And we know if we have issues with permanent teeth, they really need to be corrected. Baby teeth, if we fall down, one knocks out, it's not as big of a deal because another tooth is coming. I've seen a lot where the front teeth, kids will go down like on the side of a pool and they'll hit their teeth and one of the teeth comes out. If it's a baby tooth, I'm not as concerned. If it's an adult tooth, they should put it in cold milk, bring it to the ER or to a pediatric dentist, and they'll push it back up in there. And many times it will catch. But you take it, as long as the root is there, put it in cold milk in a container, a baggie, doesn't matter. Bring it to the dentist and they can put that tooth back. It's cheaper. When a patient's receiving anti-thyroid medication, the PN has knowledge that what? Why would we give anti-thyroid medication? And what are things we need to be concerned about? So when you have antithyroid medicine, it means that your thyroid's producing too much. So either it's a lifelong daily treatment or they need to take the thyroid out. But then it's lifelong hypothyroid medicines that will be given, okay? So without that, what happens when you have too much thyroid hormone? You have elevated heart rate, you get elevated temperatures, you can get chest discomfort, difficulty, dyspnea. So it's not a great feeling. So they want to block the amount of medicine, that thyroid hormone that comes out. So it is lifelong. It has to be taken, or they're going to have those feelings and it's going to be even worse. Which of the following is not a focus of the infant exam? Like, which one is above an infant? We know when babies are born, they do not focus as well as they should. But even they have, it's been said, black and white mobiles are fine as long as they have some sort of pattern on them. They don't see colors yet. They can hear, they can track. Absolutely, we're going to be checking for heart murmurs, and you could do the red reflex eye alignment. Those are all okay, but they don't see color yet, so you can't do it. When providing for a febrile patient, all of the following are true except it is shown that antipyretics will shorten the course of the illness. If you allow the fever to be up, the body is in there trying to fight an infection and it can't, there's no time to fight it, right? Get those fevers down and then the body can act normally and just attack whatever viral or bacterial illnesses are there. So antipyretics do shorten it. Did you ever think about that before? A mother is concerned because her 9-month-old cries whenever she leaves him with a sitter. What is the best response you could give to this mother? Like, why is the kid crying, right? So we all know about separation anxiety. And when a child, infant, less than a year old, is crying, wants to go back to mom, absolutely normal. And it shows that there's a really good connection between the baby and the mother or the father or whoever has that child and they're crying about. Which preoperative action is most important to implement for a newborn meningomyelocele? What is it, meningomyelocele? This is when a baby is born and the meninges and the spinal cord are out the low back. And this is big purple blob sitting there. And because it stretched those nerves, there's a lot of decreased function in the lower extremities. But you've got the spinal column and meninges hanging out, right? So your most concern is infection. Yes, we will monitor neurologic functioning, but that's not going to change no matter what you do. But you can give this infant an infection, which is what you don't want to do. Many times they'll put normal saline on a sterile dressing and keep it covered so that until they get that put back inside, they won't get an infection. A 6-year-old girl had surgery 12 hours earlier. The child, she says she has no pain. And then the mom says, yeah, she does. Why is the child saying she has no pain? You know, this is like a lot of my dissertation for my PhD, all about needle phobia in children. They're not going to tell you they're in pain because they don't want to get a shot. They don't want that needle. They don't realize it could go through the IV. So they'll say, no, I'm not in pain. It doesn't hurt. And you could tell by the grimacing, the way they're laying there. So if we explain how we're going to give the medicine, many times the children will say, oh, okay. Because surgery, they need to get up, they need to get out of bed, they need to walk, they need to cough, they need to deep breathe. Without pain medicine, these children aren't going to do it the way they should. So the reason why the child said that is because she don't want to get that shot. That's what they're feared of. A mother calls to ask why her son's circumcision has yellow crust over it. What information should you give? You leave the crust there, and you're just going to take and put the petroleum jelly or whatever the doctor has told you to put there to keep it soft, okay? And then, of course, have a loose diaper so it's not rubbing on there. And if it continues, and if the yellow turns serosanguinous or gets red or runs a fever, then you would bring them into the clinic or to the doctor. But leave it there. It's part of the healing process. A child with croup is having a barking cough episode. Mom calls and asks, what should she do first? The kid's at home barking, 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 coughing, coughing. Now, this has happened many a time to me, and especially my daughter. She would always get these coughing attacks. Get her in the bathroom, close the door, turn the shower on hot. And what I do is I put my daughter over my lap, and I used to pat her back with CPT. And that would help the lungs open, and then it would help stop this episode. The one thing about croup, the change of environment changes the cough. Many times the kid will be home coughing, 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 barking. They go outside, come to the ER, and they stop barking. And they're like, why? The kid was really barking a lot at home. I'm like, I don't doubt you, because that change in environment does make a difference. But when they're having this episode that's continuous, then in the shower, and not inside the shower, just the steam outside the shower is what they need. What would you see in a child admitted with a possible intussusception? Well, an intussusception is usually your toddlers. And an intussusception is when the intestine sucks up into the other one, and it causes sudden, intense abdominal pain. And it forces a little bit of currant jelly stools with some blood in it. And that's that red currant jelly stools. Now, how do we get rid of it? Well, many times by themselves, they'll just come out by themselves. And we know when the kid has a stool, a normal stool, that it's already has been resolved. And we do this diagnosis as we get them into the ultrasound. I can't tell you how many times a kid came in, you know it's an intussusception by all of the signs and symptoms, but when we get them to ultrasound, they have already reduced by themselves and we can't get the picture of it. How do we treat it? Well, we tell the parents, increase the fiber in the diet. And that's going to allow that stool to keep open in those intestines and not to come back in. A multi-select. Immunizations required for school-age children in public schools are it's everything. You know, we give the DTaP, At birth is hepatitis, then we get to DTaP, varicella, MMR, 12 months, 15 months. I mean, these are all things that we do require for the children to go to public schools. You know, kids getting together, they do exchange all of their germs. So to keep all the kids safe, we would hope they're all immunized. But we know there are some parents, due to religious or other reasons, that they don't vaccinate their children. Remember, those children put other children at risk, because just because you got a varicella vaccine doesn't mean you don't ever get chickenpox. I've seen children with varicella vaccine get chickenpox. What 3-dose vaccine is given to protect boys and girls against cancers caused by this infection? Usually given somewhere, you know, age 12 is when my kids had to get it. You know, in girls, it's to prevent cervical cancer. You know, it is HPV, and it is a 3-dose vaccine, and it is for boys and girls. Most people think it's just girls, but boys also. I mean, boys can give it to girls, right? A 2-year-old's speech is garbled and only 2-word sentences. What should you recommend first? So their speech doesn't, you know, understand it, and they're only using 2 words in each sentence. Well, how many words should they be using in a sentence by 2 years old? So whenever, it should be 4-word sentences. That's what it should be. And that garbled speech is telling you maybe it's hearing. So you have a problem with speech, first thing, always go to the hearing test. Make sure they're hearing correctly, because hearing and speech are both connected. What should lymph nodes feel like when a child is well? Remember, lymph nodes are where all of the antigens and antibodies and white cells are going to fight infection in the body. And when you're feeling well, you shouldn't be able to feel a thing. They should be flat and not palpable. When they are sick is when they get inflamed, and then we know something is going on. But you should not be able to feel them if the kid is not sick. What can be a symptom of an infant unable to sleep at night? Like, what would be a reason? Why can't this infant sleep at night? And it's probably a diaper rash. Can you imagine? During the day, we change an infant frequently, right? But at night, they usually go a longer amount of time. If they're urinating and stooling in a diaper, that you have a diaper rash, it burns, it hurts. So that could be the reason why a child, an infant especially, is not sleeping. So how do we treat it? Well, we put a petroleum, some sort of barrier to keep that acid of the urine away, or the stool, and the kid will be able to sleep longer. Or we need to wake up during the night and change the child, right? A multi-select. What instructions would you give to a parent with a newborn with hip dysplasia and is required to wear a Pavlik harness? Well, what is a Pavlik harness? Now remember, newborns, their bones are flexible, they heal quickly. I mean, casts are only needed for 2 or 3 weeks if for whatever reason they have a broken bone. Now, this is that little white thing that goes over the shoulder, and the knees are adducted into, you know, the body. And it holds it there because the hip was born out of socket. It should be here, but it was born up here somewhere. So you put a cotton t-shirt underneath so it prevents any of that rubbing because kids do move their legs. You only remove it for bathing, which is 23 hours a day. They wear it, so they take it off only to bathe, okay? And taking it off and on is not needed. Leave it on. Let those hips get back in there. And most of the time it'll work. Another multi. An infant's born with a myelomeningocele. How does a nurse care for this? Well, because the myelomeningocele is in the low lumbar area, the low back, those children are the only ones that we put on their belly to sleep, but they're on a monitor. So we are monitoring the respiratory so you don't have these SID stuff, okay? And we're going to just keep that area covered with a moist, sterile dressing. No, they're not going to be on their side because they should be on their tummies to keep that myelomeningocele free from injury. And we don't put antibiotic ointment, just normal saline, sterile dressing. That's all we need. You walk into a room and a student nurse is trying to insert a tongue blade on a child having a seizure. What are you going to do when you see that? Well, you're not going to try to put anything in a child who's having a seizure. What do you want to do? How do you protect? What's those safety things we do for any child, any patient, client that we have? Well, turn them on their side. Free the bed of anything that's sharp that could injure them. Put the bed flat. If you can, pad those side rails. And of course, call for help. Get somebody in there with you. There's nothing you could do. Monitor the time it started and the time it ended so that you can document. That's it. Leave that mouth alone. There's nothing. You're going to break teeth. That's all you're going to do. What is one side effect of chemotherapy that can affect a child's self-esteem? And that is hair loss. I mean, I've seen fathers and brothers and uncles all shave their hair for their child. What I used to do is I used to have little, I'd go to Walmart or Target, whatever, get those little spools of ribbons, all different colors. And I would go in and put a little headband or a little bow on that child's head every day. And I would wear the same one. And those kids felt it was special. So I took a self-esteem issue and made it like something special so that they didn't feel like they were different. They felt special because their nurse also had those bows in their hair too. And those little things make a difference in a child's life. A multi-select. The child just had his hypospadias repaired. What would be an appropriate play? Well, what is a hypospadias? This is something where the penis doesn't have the opening on the tip. It's underneath on the dorsal part of the penis. So what are we going to do? There's epispadias and there's hypospadias. Well, we have literally filleted that penis open, used the foreskin to do a plastic cover closure on it. And we don't want anything to injure it. So no baseballs, no riding bikes, no rocking on horses, none of that. Soft blocks, coloring, very easy stuff. Protect that penis because it can, undo itself. And then what are we going to do? Poor kid. What test is done to diagnose cystic fibrosis? So cystic fibrosis, it's the sweat test. And what do we see in a sweat test? Well, I've often said if you have a child that you suspect cystic fibrosis, if you licked this child's skin, it would be salty, salty, salty. So it is a sodium sweat test, and it will show, yes, it is. And remember, cystic fibrosis is the lungs, and it also has to do with food and digestion in the small intestines. So this is a twofold disease that we have to really, give good care. Aggressive chest physiotherapy, and also making sure they get enzymes before they eat, and monitoring, their weight and their height, because they lose a lot of vitamins because they don't absorb fat soluble vitamins. So cystic fibrosis, usually we find a little bit after birth, and it will be a sweat test. Or maybe we know it's going to be, so we'll do that test anyway. What medication should you use for pain management for an infant after a pylomyotomy? This is after a pyloric stenosis repair. Remember, pyloric stenosis is the pyloric sphincter is highly muscular. Oh, milk can get down, so they have to open it up. So food can go down. And, infants do really good with just some Tylenol. Rarely do they need more than that. I mean, they always put the order there, but just Tylenol. Remember, infants up to age 6 months can only have Tylenol. After 6 months, you can add in the ibuprofen, okay? We would never give Percocet to an infant. Another multi. What are some signs of a new onset diabetes 1 in children? So remember, diabetes is where the pancreas doesn't secrete enough insulin, so you cannot use sugar in the body. There's nothing to digest it. So these kids are they're hungry, so they're eating, polyphagia. Now they're also urinating a lot, they're drinking a lot, and they're losing weight because they can't use sugar. Another thing that they see is that bedwetting or enuresis. That's the same thing. It's a different name. Could be one of the first signs that we see is the enuresis, okay? Before they get to the weight loss and all the other symptoms. So any one of these, I'm telling you, your physician will be checking that child for what's the blood sugar. And they'll just do a simple blood sugar, see where you're at right now. And that could start the process. At 6 months old, an infant's birth weight should be what? So at 6 months, it should have doubled. When does it triple? 1 year old, yes, it does. And actually at 2.5, it quadruples. What symptoms would you see with a child with epiglottitis? That means an inflammation of the epiglottis. Well, what does the epiglottis do? The epiglottis covers the trachea when you're eating or swallowing, so that food goes in the esophagus and not down the trach. Well, now that big epiglottis is swollen. Now, you can't breathe. You can't breathe at all, okay? So what do you see with it? Well, actually, you're going to see all of these things. You're going to see a little bit, not much of inspiratory stridor. This child will be drooling and restlessness, and then that garbled speech. I need to change this one for the next. So I'll send it out to you with the corrections of it. Because what happens with this one is, it's actually a medical emergency because air can't get in. I mean, once it's in, you could push it out, but you have to find, and they're leaning forward like a tripod, looking for a place where they can get that air in there, okay? So you might hear that little bit of inspiratory stridor because of everything's covered. And they can't swallow, so they're just drooling a lot of mucus because they can't swallow it. And now, because of lack of oxygen, that's where the restlessness starts. And because it's the oropharyngeal airway, all of that is going to be garbled too. A multi-select. What sign would a child show? Pinworms. You know, kids like to go out, get into the backyard, sit in the dirt or sand pits, and everything's in the mouth, and that's where all these eggs are, right? It's something that can happen. It's nobody's fault. But how do we figure it out? Well, what happens is usually, and especially at night, you will have all of this rectal itching, okay? Now, in girls, it can go into the vagina too. So they'll have that vaginal itching. And they're not sleeping because they're itching. And what we do is take a piece of tape, Scotch tape, put it in the rectum, pull it out, and you'll see tiny little white spots. And then they're going to have medicine for those worms. And of course, changing the sheets so that we're getting rid of all of those worms. Another multi. An infant is born with a tracheal esophageal fistula. Nursing care. Well, what is a fistula? It's an opening between two places, the trachea and the esophagus. Now, if I swallow, it goes down the esophagus, but it goes across that fistula and right into the trachea, into the lungs. So now I'm having aspiration pneumonia, right? So how do I treat it? Well, you want suction at bedside, because even that normal mucus that you have in your mouth, this normal spit that you have there, they'll swallow it, and that causes aspiration pneumonia. We're not going to feed these children at all. Head of the bed is elevated because they can breathe easier, and they'll be on IV fluids, NPO, and why are we giving IV antibiotics? Because of that aspiration. So we're going to prevent aspiration pneumonias. A diabetic child is complaining of shaking, sweating, and confused. What priority treatment will the nurse provide? Well, the child's complaining, so the kid's alert. Shaking, sweating, confused are signs and symptoms of what? Hypoglycemia. Do you really need to get a blood sugar before we give them some milk? No. Go ahead and treat it. Glass of milk, glass of orange juice, something. Give them something. These children are taught to carry like hard candies, you know, in their pockets, something. They start that shaking, sweating. This is a problem. Get something into them.
When asking these questions, should we be, I guess maybe the key in that question was in treatment. Is that the clue that you're giving assessment and going straight to implementation?
Well, on the last one is your assessment showed you what was going on. They're shaking and they're getting confused and they're complaining and they're jittery. So what is that a sign of? What is that a sign of? That is hypoglycemia. How do you treat hypoglycemia?
You don't want to check it first.
No, you don't need to have a number. Now, give them something to milk and check it at the same time, and you're going to show it too. But get them treatment, because what can happen? It could go even lower, and then you're going to go into diabetic coma, which you don't want. Okay. And that's a good question. Thank you. What teaching should the nurse give to the parents of a child with a urinary tract infection to prevent further infections? So you have a little girl, little boy, already having urinary tract infections. How are you going to prevent them? Because remember, a lot of this prevention is not doctors, it's nurses teaching parents and children how to prevent these things. So we want to write wipe front to back, not back to front. Wear cotton underwear, no bubble baths. And in little boys, pull the foreskin back if they're uncircumcised. Make sure we clean underneath there. No tight, constricting clothing. All of these things are important with children. How do we also? Well, increase fluids, right? Keep that moving. And of course, monitoring their urine and see if there's any irritation there. We can prevent them before they happen. And last question, why is propranolol used sometimes for Graves' disease? Graves' disease is hyperthyroidism. Propranolol, olol is a beta blocker. Why do we use beta blockers? To block the beats. Does that make sense? So it's going to prevent them from tachycardia. Remember I told you with hyperthyroidism, you can have elevated heart rates and elevated temperatures, and you get this tightness in the chest and you have trouble breathing. And that's all because of too much thyroid hormone. So we give propranolol, which is the other name is Inderol, which is a better blocker, and that will slow down that heart rate, which is what we want to do. It's used for any of those crises in thyroids. Tiffany, good job. Number 3. Number 2, CT. Chandra. Number 1, Sade. Good job, Sade. All right. Now, anybody have problems with any of the math that we've been doing? Anybody have any problems with any of the math, the insulins, the heparins? Have you seen questions like mics per kilo per minute on your med surge or on your going forward? Are you going to see that in your capstone? Okay, let's go over some things to try to help you here. Did anybody think of an area where they needed me to talk about? Now, Sade, you were talking about APGARs. So let me just pull up something here on another computer. And let me give you a little thing about APGARs. Okay, Sade. APGARs, your number, the best one you want is a 10, right? Your baby's born, it's a 10, normal, healthy, they're breathing, their color's good. Now, what are the components of an APGAR score? Number 1 is your color, your heart rate, your reflexes, muscle tone, and respirations. Those are 5 different areas. Now, depending on what that infant looks like, if you see them that their heart rate's too low, they're not perfusing enough. That means they're going to need something to vigorate them. Many times we spank them on the bottom of their heels in order to stimulate them. And on the bottom of their heels, actually it works well. It's better than on their butt, right? You see them pulled out in the movies and they spank their butts. Well, we don't want to do that.
Is that why they used to do the butt? Is that what they used to
Well,
do?
years ago, yes. But they used to be hanging them upside down and spank them. And now we know that their heads are very fragile and all the vessels in the brains are. That's why they don't do it anymore. I mean, you're going to see changes in nursing as you progress and years into it. I mean, I could tell you a bunch of different changes that I've seen, and it's only for the better because now we're all about doing evidence-based practice, which we know through research that these type of methods that we're doing today is better for the child, for the adult, for whoever. Okay, what if you see they're not breathing? Well, you're going to do two things. Of course, you'll stimulate them. You'll suction out that airway, or we might have to use an ambu. We might have to breathe for them. And remember, a lot of these things depends on how old was that child at birth, the gestational age. At 34 weeks is when the lungs mature. And there's surfactants there that holds open these lungs. After 34 weeks, usually respirations and the colors are all okay. Now, 32, 33 weeks, they have no surfactant. And what that means is those alveoli collapse. So they can't get oxygen in, because where do you exchange oxygen and carbon dioxide? On the alveolar level, right? So if they're not open, you're not exchanging. So many of these children are intubated and sent right over to the newborn ICU. And they'll actually give a synthetic surfactant. I was a part of a study when they first started doing that in the mid-'80s at Jackson Memorial Hospital, big county hospital, big newborn ICU. And they were doing pilot studies there. And they found it works, and it worked well. And those premature babies, less than 34 weeks, had better outcomes. So I saw that. Does that help you?
Yeah. I guess I was confused during the case study about when it's like 5 or 6 versus when it's like 3 or 9. Like, how do you determine? There must be some type of sheet that tells you which intervention you do at 5 versus which interventions you need at 4.
It depends on what's the problem. It depends on the problem. I just focus with the heart rate.
Yeah.
You're going to try to get it elevated. Sometimes you have to ventilate them more, or maybe it's the oxygenation. You know, let's look at the O2 sats. You have to find what assessment is showing me what I need to do. Do I need to elevate a heart rate? Do I have to have them breathing? You know, do the muscle tone? I mean, a lot of times that comes down the line. Remember, sometimes these kids are born with things like CP. You know, muscle tone's different. So you really have to look at each specific, what are those symptoms that you're seeing, and then treat those. I know it's complicated.
It is, but I definitely appreciate you going into detail.
No. Not a problem at all. All right, let's go into some math stuff. Let's go into can you see this on your screen? Now, one of the things that I've had students really get frustrated about is things like when you see heparin or insulin on a question, and you're like, I don't know. I don't understand. And I say that if you don't like the label, use a different label that you want. Okay, you don't like the word units, put milligrams. As long as they're all the same units, it doesn't matter, okay? Now, we can just go, first of all, let's do a simple number 3. A child is weighing 55 pounds. And they're prescribed 0.15 micrograms per kilogram of digoxin IV. And you're okay. Let's do this one first. So,
which one are you doing? Number 1?
I was doing number 3.
Okay.
Now, all of these I've sent to you at the beginning of the semester. I sent to you 3 dosage calculation forms, and I sent you a pre-recording that I had done on these things. But I like to go over them just as a review, because these are the type of questions you'll see on the HESI. So 55 pounds, this is what the child weighs, and we want to give 0.15 micrograms per kilogram. And all they're asking for in this question is a dose. So what do I need to do first?
Change it to kilograms.
All right, so how many kilograms is that?
25.
25. And all I
Then
do
you
is,
multiply it, right, by the micrograms?
yes. Because every kilogram gets 0.15, so you have to multiply it by 25.
Hey, y'all.
So,
Yeah,
Now you cut.
I'm gonna get done at 5:30.
so what we do now is we're just going to multiply these things. So 25 times 0.15 equals, and I'm telling you, when you do your math, do it 2 times. If you get the same answer 2 times, that will be your answer. So 3.75 now, and that's micrograms. Now, the other thing I ask you is, what is that the final answer? Well, go back. This is where I always say, go back to the question and look, what is it asking for? Did it ask you to the nearest whole number? Did it ask you to the nearest tenth? So if I want to put that to the nearest tenth, what would be my final answer?
Oh,
3.8.
3.8.
3.8. Okay.
Oh.
Again, always do the math twice, the pounds, the kilograms, and the conversion. And then when you get an answer, don't just put that in, go back and look at the question, see what they're looking for, okay? I have had students tell me that they have almost made errors, but that did help them. All right, now let's go for that heparin question, number 4. Now, there are 3 sort of questions, and there's 3 formulas, and I have them listed here on this piece of paper here. We have the dose, what we want to give, what the doctor ordered, doctor prescribed, and then what we have over half. What did the pharmacy send me? What's available, okay? And then it's going to be multiplied by what quantity was it delivered in. For instance, ibuprofen, you have 100 milligrams and it comes in 5 mLs. So you would make sure that you line those up. So let's look at, and then you have just mLs per hour and drops per minute. You need nothing else to figure out any problem, including mics per kilo per minute, okay? Because it is a dose that you're delivering. So just keep those formulas in mind. That's all you need to know. Let's go back and look at a client is prescribed 5,500 units of heparin per hour. It's available 5,000 units and 500 mLs. The nurse will set the pump to deliver what? Now, how do I set up this problem? It's a dose, right? It's been prescribed. It's been ordered. What is my dose?
It would be 5,500 over the 5,000.
Yes, it is. And we'll multiply it by 500. And I always put that 500 over 1 because, you know, sometimes you've got a little piece of paper and it's getting crooked and you wrote too big and you're going to get discombobulated. So 5,500 units over 5,000 units times 500 mLs over 1. Now your answer is asking for mLs, right? Anything over itself equals 1, so you can take off units. So we know our answer is going to be in mLs, which is what you want, right? That sometimes helps. Now, what do we do? Is always multiply the top and then divide the bottom. especially when we're going to get up to mics per kilo per minute. This is the way that you'll have less rounding of numbers, and this way it's going to get you your answers easier, quicker, with less errors, okay? So let's go to 5,500 times 500. Let's do it again. 5,500 times 500. And when you're looking at numbers, don't say that number is too big, because as long as you've done it twice, it's the number you want. Don't be concerned what the number is. And then we're just going to divide that by 5,000. And our answer is 550 mLs. Okay?
Would it be wrong to do it the other way?
What other way?
Ever? Like divide the top by the bottom and then multiply?
Okay, I used to divide this first and then multiply. What happens is, a lot of times you're going to come out with a number you have to round. That's a chance for error. When you do multiply first, you never, ever have to round. And as we get ahead, when we do mics per kilo per minute, it will make more sense, okay?
Okay.
So let's just do it that way. And I'm telling you, it will make your life easier in the long run, okay? But that's a great question, because I used to do it that way. And as I kept doing it, I realized, why am I having to round? Let me try this. And all of a sudden, it just was smooth. I've never, ever had to round when I've done it this way. All right. Let's see what else we have here. Are you all good with your mLs per hour?
Yeah.
Do you need me to go mLs per hour? Here are some more heparin questions. You know, if you want not heparin, make them insulin. They're all units, right? Do you need to go over those more or not? You tell me what you want.
For number one?
All right, let's do number, well, let's do number 3. I like number 3, whatever. All right, how am I going to set it up? What formula?
1,200 divided by 2,500. 25,000 times 200.
Wow, you did that quick. Good job. $1,200 units divided by 25,000 units times 200 mLs. Remember, units over units, they cancel out because it's 1 over 1, unit over unit is 1. We don't need it there. So again, multiply the top first and then divide the bottom. So if we multiply the top, and again, do it twice, and you get 240,000 divided by 25,000. And we know mLs is going to be our answer. So let's divide this out. And our answer is 9.6. Again, go back and look at the question as you get to exams. I'll say to the nearest whole number, to the nearest tenth. Whatever it is, make sure now that you would look at that. Because that there was few questions on the exams where they asked for the whole number or to the 10th. And if they weren't rounded properly, the answers were wrong. Even if I knew they were right, I couldn't make them right because it wasn't given to me in the way it should have been, okay? Now, I'm going to go to another form here. Now, I think this is one of the hardest things that we can do. But actually, I think it's sort of fun because I'm a weird math nerd here. But when you get into med-surg and you work critical care, many times they put these patients on medications that either support their heart, blood pressure, prevent dysrhythmias, all different things. Like nipride is a medicine that takes the blood pressure and raises it. That means there's something going wrong. This person's not perfusing. They're in shock of some sort. So we need to support them. Now, xylocaine is something that's used for what? Ventricular tachycardia. So let's do number 1 first because it looks the easiest. Again, these are all asking for a dose. So if we look at question number 1, xylocaine 1 gram IV in 500 mLs of D5W at 3 milligrams per minute. What is our dose? Anybody? Tamika, what's our dose? Number 1.
The dose is 1 gram. I'm sorry.
Well, let's look at this really carefully. They gave you a bag of 500 mLs with xylocaine in it. So that came from the pharmacy. I'm infusing at, running at, or at 3 milligrams per minute is the dose. So the dose here is 3 milligrams a minute.
1,000.
It's 3 milligrams a minute is the dose. And then what do I have on hand? Well, we have 1 gram.
1 gram.
And our quantity, 500. Let's do that one. I'm going to make it real easy for you guys. These are not hard questions once you figure out there's only 3 ways to do it. And let's look at what our dose is. Our dose is 3 milligrams per minute.
The minute will turn to 60.
The what? What are you asking?
I said the minutes will turn to 60.
We will, okay. So just put down the DHQ. I'll get there, Adrina, thank you. I'll get there. I'm gonna answer your question. First, take the information out and put it down. This is our dose, 3 milligrams a minute. They said 1 gram and 500 mLs. So put it down. Next thing we need to do is, all right, 3 milligrams. Now we want mLs per hour. So we have to multiply that by 60 because minutes is minutes. We want an hour, so we have to do that. The next thing is we have a conversion here. How do you make grams into milligrams?
1 times 1,000.
Yes, so it'd be 1,000 milligrams. Very good. And we just multiply it by the 500 mLs. Again, milligrams get crossed off. So we will be left with mLs per hour. So we know we're getting the right answer. So again, now do you see why you multiply the top and divide the bottom? Because you can't do it the other way. Why would you want to first multiply and then divide it when you can just multiply and divide? Less chance for errors. And that's why I do it this way. So 3 times 60 times 500 is 90,000 divided by 1,000. If you like to take off zeros, your answer is going to be 90. Does that make more sense now, Tamika? Did you get it?
Yes, I got it, but I get confused when it says per hour. So per hour, we don't
right there. That's
6.
your hour. No, it's already there. You have minutes. So you only had to add that to hour. Now, if it was 3 milligrams per hour, you wouldn't do anything. You
Thank
adjust 3 milligrams times 60
Okay.
because it's already there.
You get a lot of those on the exam.
Right. That's why I'm telling you these things. And I just wanted to go over. I don't anybody. It gives me heartbreak. Anybody getting a math question wrong, because I am such a great resource, and that's why I'm sitting here doing this with you now. You know, just
how many math questions we're getting in the HESI?
Usually there's 4 or 5. Almost very much like your regular exams. They do throw them in there. And it depends on which HESI you're taking, what type of problems they put in there. Definitely pediatrics are going to be micrograms per kilogram and a dose for sure, right? Absolutely, that's going to be there. If you're into even community and leadership, next our psych next semester is mics per kilo per minute. You're going to see these things. So as you're entering that and finishing Med-Surg 2, this is something great for you to learn. You know, just a refresh on you. All right, let me do the hardest, as I call it, the hardest of all types of questions. Number 2. Now look at all that information there. La da da la da da la da da la, right? So what do I need to know about that question? Well,
first you would change the 2 micrograms to milligram.
no, you don't have to.
No,
Let's first find out.
No,
what is
because
our
you
dose?
gotta
Hold on.
Change
like
the
know
pounds to kilograms.
You gotta change the pounds to kilograms.
Okay, so we have 125 pounds. Now, what formula? It's a dose, right? It's running at what? Two micrograms per kilogram per minute. That's your dose. What did the pharmacy send you? 500 milligrams.
2 microgram.
500 milligrams.
And how big was the IV bag they sent it in? 250
milliliter.
So, all right, so 125 pounds, that will have to change. So the dose we want to give is 2 micrograms per kilogram per minute. This question has a lot of conversion changes, but this, again, only put down the information they give you. Do no changes until you write it down first, because you will forget something and you will inadvertently not do it and the answer will be wrong. So first thing is 125. We got to put, how many kilograms is that?
56.8.
So we round up to the whole number?
No, leave it where it's at.
Okay.
Where do you, it's like a long number. Where do you stop it at?
56.8 is good. Do it to the 10th. Okay.
Okay.
And oh, this one's to minute. And again, this question wants mLs per hour. So we're gonna have to multiply that by 62, right? Mm-hmm. Now you have micrograms and milligrams. Well, this is the dose. That's the answer you want. So let's change milligrams to micrograms. And again, it's going to the right. Grams to milligrams, milligrams to micrograms. You multiply by 1,000. And this can come off. And this is micrograms again. So again, micrograms comes off. And we're left with kilograms per hour, mLs per hour right here. So again, we're going to multiply. You see how you're now multiplying across. 2 times 56.8 times 60 times 250. And you do it again. 2 times 56.8 times 60 times 250. 1,704,000. And again, please don't look at numbers and say the number looks too big. Okay, I did it twice, that's what I got. And we're going to divide it by 500,000. So we know, again, mLs per hour is our answer. Our labels have been taken off because they do that. Let's just divide this number and let's get our answer. And the answer is 3.4. Does this make it easier for you? Are you understanding it this way?
Yes.
Again, remember, it is a dose that's being delivered, okay? Now, if you look back at the beginning of the semester, I sent you all of these, all right? You can have them. If you're going back and you can't find it in the Canvas shell, I believe it was the second week I sent it. If you need me to send this again for you to practice, because, you know, 4 questions is a lot to get right or wrong. Remember, focus on, in pediatrics, mics per kilogram and figuring out doses, okay? And remember, sometimes the doses are also, when they're telling you things like this. Let me give you an example off the top of my head. So you have a child who you want to give, let's say, the kid weighs, let's say 20 kilograms. We'll just put it up there. So we want to give 50 milligrams per kilogram per day. And the order is written to give twice a day this dose. And they sent you medicine, which was 100 milligrams in 5 mLs. This is a question you do see. This is the most complicated of pediatric questions, because when they're asking for day, but this answer down here just wants the dose. How much per dose? So if we take 50 milligrams times 20 kilograms, that equals what, 1,000? Thousands of milligrams, but this is per day. Twice a day is what I want to give it, right? So I have to divide that by 2. So it equals 500 milligrams I'm giving per dose. Are you following me here?
Yeah.
So that's my dose. The pharmacy sent you 100 milligrams in 5 mLs. And again, multiply and divide, and that's going to be your answer. $500 times 5, and do it twice. Over 100, and the answer is 5 mLs per dose. There was a question very similar to this one on the last exam, if I'm not mistaken. But that'll be your most confusing of, not confusing, multi-steps. It just, you have to think, you have to look at the question. What is it looking for? Is it per day? Is it per dose? And then figuring out the dose, and then figuring out what you have on hand, etc. So that will be your most, you know, one that you have to do the most steps for. Anybody have any questions?
Oh, Professor Chris, can you go back again for me?
What would you like to know?
How did you get 100 milligrams?
Because the pharmacy sent me 100 milligrams in 5 mLs. That was given to me from the pharmacy, what's available. So that's how that came 100 milligrams. And it's in 5 mLs, and I put the 5 mLs.
Oh, okay. I got it.
Okay.
Thank you.
All right. No, you're welcome. If you don't, I don't mind going back if you don't understand. In fact, I hate it when you tell me, because I'm sure somebody else was wondering the same. Okay, Sunday, I am going to be doing my review, 2 p.m. It will be recorded. I will be sending it out. I'm going to wait till the recording comes up and get it to you as quick as possible so that you do have it. I also will be posting these a little bit later so that you have this recording to go over the Kahoots. You all have your NCLEX PN book, right? For your Saunders, which goes over your pediatric section. I highly recommend it. I have seen those little HESI hint things. They pull them out of there like crazy, okay? And anybody who needs anything else, please just holler for me. I'll be here to help you. When are you all taking your HESI? The end of next week or when?
Friday.
You are doing them on the same day. Okay.
Thursday from Cincinnati.
Okay. Well, anything, let me know. I wish you luck. Remember, there is class, but brief class on next Friday. Just a recap, looking at your grades. Again, if you're seeing the grades, maybe I missed something. I didn't score something. Whatever your concerns on, let me know so that I can make sure.
Wait, next Friday or week 12?
Week 12.
I'm sorry, next Friday. Okay, you said next Friday. I was going to say, wait a minute.
No,
I thought you said no. Sorry.
No, next week is your HESI. That's your attendance. Week 12 is the class. It is attendance. So I know it's different, but what was happening is it didn't show attendance in the books. And that could create problems for attendance drops. And we don't want somebody to be dropped because they didn't come to class when we have been talking back and forth, many of us, even into week 12. So that's all I have for today. Thank you all for coming. I will see you all week 12.
Thank you.
Or if you can, meet me on Sunday, and it's going to be a pretty good, another HESI review for you. So, I wish you all the best.
Thank you
so much.
Thank you.
My pleasure.
Bye.